Hello, my name is Yudi, and this is the Yudi Factor. The Yudi Factor is a program that understands that knowledge is power, and therefore week after week we discuss issues and empower you with information to enable you make informed choices, especially when you factor in something you have heard on the Yudi Factor into your situation. Today we're going to be talking about arthritis. Some people believe it's age-related. Some say it's age-associated. Some say even a child can have arthritis. Today we have Professor Femi Adelowo, Professor of Medicine and Consultant Rheumatologist, Lagos State University College of Medicine and Lagos State University Teaching Hospital. He is the President, African Associations of Rheumatology, and Chairman, Executive Committee of the World Body of Rheumatologists. Well, I am in the right corner, and all of you who have arthritis out there, both husband, wife, child, make sure you have 60 seconds to invite your friends to be empowered with information. My name is Yudi, and we'll see you after this time out. Professor, you're welcome.
Thank you very much.
Thank you for honoring our invitation at such a short notice.
Thank you for inviting me.
I believe I'm in the right corner with all these titles and all these recognitions you have received. What is arthritis? Is it age-related? Is it age-associated?
When we talk about arthritis, we're talking about disease or inflammation of the joints. Now, the joints are the movable parts of our body, and our body is made up of joints: our knee joints, our ankle joints, our joints of the wrist, the fingers, the shoulder. We are made up of joints, and even the back. Now, when we talk about arthritis, we're talking that there's inflammation in a particular joint or a set of joints. But arthritis is not by itself a diagnosis. Arthritis is a manifestation of many diseases. Therefore, many diseases can present with one form of arthritis or the other. Now, to complicate matters a little bit more, we also talk about rheumatism. Now, rheumatism refers to the affectation of what we call the soft tissue surrounding those joints. If we remember, our joints is not just organs. We have muscles, we have tendons, we have ligaments surrounding those joints. When those ones are affected, we actually call them rheumatism. But when the bony parts are affected, then we call it arthritis. And there are more than 200 types or causes of arthritis. So when you say you have arthritis, you're not saying much. It's like saying somebody who has a headache. Headache can be due to so many things. It can be something as minor as you tie your headgears too tight, as females, or it can be something more even severe or sinister, like having brain tumor. So it is just a manifestation. It is not a disease. It is a manifestation. Therefore, arthritis is just a manifestation of many diseases.
That's very informative, because we just all say arthritis. Is it age-related or age-associated? Is it?
Now, there are some that are age-related. For instance, the commonest type, which is from the wear and tear of our joints. Our body, because the joints are moving all the time, they are bound to wear and tear, just like the engine of a car. You talk about the piston or the engine block wearing off because of the continuous movement. So also, we have this type of arthritis called osteoarthritis or degenerative arthritis. It is the commonest type of arthritis, all the same, but it is not the only type of arthritis. Osteoarthritis is age-related. only pick it up in people who have used their joints over a long time, such as elderly people or middle-aged people.
That's osteoarthritis.
That's osteoarthritis.
Okay.
There are other types of arthritis.
Okay.
There is, for instance, that one which is due to the deposition of some bad salts in the joint, which you call gout. That is in young men, or sometimes postmenopausal females. But we also have this type of arthritis where the body is at war with itself, what we call autoimmune disease. Rheumatoid arthritis is another type of arthritis in which the body is at war with itself. Okay. Quite a strange thing to know. But the reality of it all is that our body at any time has soldiers in our blood called the white blood cells, which are protective against us. And what they do is that anytime a germ comes in, they round it up and kill it up. Okay. For some reason which you still don't know, in many instances, some of these white blood cells or the soldiers of the body gang up together and do what in our own parlance we used to call coup. They do a coup against the body. Yes. And in that coup, there's a lot of ruffle fight between the coup plotters and the body itself trying to resist. So is that type of the interaction between the coup plotters, which are the white blood cells here, and the ordinary white blood cells, which now causes damage to the joints. Okay. That's just one example. We have so many other examples. You have a particular one which is probably more widespread, what to call systemic lupus erythematosus, or lupus, okay, in which, again, the body is at war with itself, and that war can be fought in the joints, can be fought in the blood, can be fought in the kidneys, can be fought in the lungs, in fact, can be fought anywhere in the body, and it's probably one of the most frightening conditions that you can have. So many other, you can also have arthritis from some skin problems.
Doctor, hold the thoughts. Hold the thoughts. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, we're talking about arthritis today, and we have Professor Femi Adelowo to talk to us about arthritis, which is very, very, very common, especially for women who were used to wearing very high shoes before, who can no longer wear high shoes. Prof, yes. Why is it so common? And what are the subtle warning signs that arthritis is you're beginning to have either of the ones you have described, either the either autoimmune, or the rheumatoid arthritis, or what are the different subtle warning signs that someone can begin to see this is happening?
Well, first of all, beginning from the family.
Okay.
Most times you have a mother who is on the robust side, and you also, as a daughter, you are also on the robust side. Chances of developing arthritis, especially of the knee, is higher. So there is some element of gene. Also, if by any chance you do not exercise your joints, the joints are meant to be exercised. If you do not exercise it, then you could be actually causing trouble for yourself. But in terms of the early features, usually what you feel is pain. It's actually pain that brings the person to the hospital. And that pain can be described in so many words, depending on how fluent your language is. It can be biting pain, it can be groaning pain, it can be gripping pain, whatever it is pain. That pain usually starts on movement. Then eventually it progresses to pain at rest. Eventually it progresses to pain at night. And then you have stiffness in your joints. You wake up in the morning and the joints are just so stiff, difficult to stretch. That's another way. Another way is that you notice swelling in your joints. And then you notice some creakiness in your joint, as if somebody has poured sand into the joint. If this goes on and on, then you begin to have some deformity in the joint. And eventually, if not properly managed, some of the arthritis can actually lead to quite a lot of disability.
There's some you see, some of our grandmothers in the villages, and you see some of them cannot straighten their fingers. Or sometimes you see somebody trying to get up and it's like they have pain in the small of the back, you know, right down. What is that one too?
Well, first of all, for the back, arthritis can also affect the back. Arthritis can affect the back. Anywhere you have bone moving up on bone, arthritis will affect it. But it's not all back pain that are due to arthritis. Okay. There are things we call the red flag signs when you have back pain. The red flag signs, like red flag means caution.
Yes.
Red flag means when you have a back pain that's presenting with so and so and so, please go to see your doctor. One of the red flag signs that we usually see is you have a back pain and you are losing weight. That's strange. You have a back pain that does not remit while lying down or at night. Most back pain, no matter how bad they are, you would have relief at night. But when you have a back pain that is, even at night, is quite so painful, you should get worried. When you have a back pain that is leading to some deformity of your back, that is also worrisome. You have a back pain accompanied with fever, loss of appetite, loss of weight, that is troubling. You have a back pain, you have diarrhea, you have constipation, you have problem with passing urine, that is worthy of note, and you should go to see your doctor. Even when you are a particular age that we expect to see evidence of degeneration in the joint, the fact that you're having these red flag signs means your doctor must exercise caution and find out why all these other things are happening. You just don't take it for granted. That is because of the degenerative arthritis that we are. You mentioned the hands. Yes, you can have arthritis of joints of the hands too, and especially in our old people. The older we are, the more likely we are to develop this type of degenerative or osteoarthritis.
There's some people you see and they have all these pains, and then you find maybe people who were active before who suddenly are no longer as active as they were, people who could climb flight of stairs before who suddenly cannot. You find women who were wearing very high shoes before, as soon as they cross into their 50s, the heels are either like this or and they complain about pain on the knee, pain on the ankle. Yeah. What is that?
Well, the human body, God in His infinite mercy and as a great designer that He is, has designed the human body for, a particular shape. Yeah. Now, it's obvious God did not design the human leg to be put on stilts.
Doc, are you talking about me?
No comments. They're not to be put on stilts. So when you do that, you cause a lot of imbalance in your ankle and the knees. Yes. And that's why many people now, young people, who had worn all these skyscraper shoes are now coming down with arthritis of the ankle and the knees. It's a consequence of trying to assume a shape that
God did not
design the human body.
Hold the thought. Prof, hold the thought. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, I'm talking with Dr. Femi Adelowo, Professor of Medicine and Consultant Rheumatologist, Lagos State University College of Medicine and Lagos State University Teaching Hospital. And he's also the President, African Association of Rheumatology and the Chairman Executive Committee of the World Body of Rheumatologists. So I'm in the right corner. We've been talking about arthritis. You can search yourself and see which bracket you fit into. And just before we went on break, he talked about women who climb skyscrapers, and I know he's talking about me, but it's forgiven. Prof, you're welcome back. So, Prof, you're going to advise us, for people who are not already faced with this arthritic disease, what lifestyle can they adopt to help them? And to those who are already facing it and going through all the pains you have described, what can they do to alleviate or to reverse, if possible, or to alleviate the pains?
Well, thank you very much. Let me start from reversing.
Okay.
Unfortunately, by the time the changes are taking place in the joint,
Yes.
it cannot be reversed. Bottom line. So what we actually do is to alleviate the pain, ameliorate the pain. And there are quite a few things we need to do. Okay. And again, it depends on the type of arthritis. Okay. Like I said, because there are so many. For instance, if it's osteoarthritis, there are drugs we can give that will release pain. The injection we can give into the joints that would help to lubricate the joints. But for the other type of arthritis, for gout, for instance, we need to bring down the offending salt of uric acid. And there are drugs we can do to do that. Such persons also need to change their lifestyle. Alcohol is contraindicated. Eating of all these, the offals of animals, the mama put.
And the roundabout and
the mama put, all those delicacies that we enjoy at the pepper soup joint,
Okay.
They need to go a bit slow on that, Many of them also develop this gout because they have problems with their kidneys or they have hypertension. So these are things that need to be checked. For the rheumatoid arthritis, there are drugs that would not only take care of the pain, but to modify the disease and therefore prevent it from progressing further. The drugs that would modify, for instance, patients who have SLE, which is one big autoimmune disease affecting mainly women of childbearing age. And it could be so devastating if it is not properly handled by the specialist who is trained to handle it. Back pain, there are few things we can do. For instance, you must avoid bending down to pick stuff, carrying luggage or carrying buckets. These are the things that contribute to back pain. What other lifestyle modifications? Avoid putting on weight, by all means. So you must exercise.
So, doctor, do you exercise?
Yes, I exercise.
Okay.
Oh yes, I exercise.
Okay.
Maybe not as regularly as you, but I do exercise.
Okay.
So you must exercise because the joints are programmed to move. They are not programmed to be stationary. So you must keep moving them. If you have a family history of weight or diabetes even, you must be very careful because diabetes is quite well recognized to cause osteoarthritis. So you need to be very careful with the sugar. You need to be also to take your drugs. I think those are the major things you need to do, just the same lifestyle modification that we have with all things, weight gain, good nutrition, don't pile up all the pounded yam and all the stuff that's going to make you put on weight, And for those who sit, and this especially for those who sit at desks, yes, you must get up every now and then to stretch your back.
Where does knee replacement come into this?
The knee replacement will come in when all the medical treatments have failed. Okay. Despite that, the patient is still having pain. Then the knee replacement would come in if is the knee affected. But you can replace some other part. You can replace the hip also. You can replace the shoulder. Quite a few joints in the body can be replaced.
I also heard that a doctor once said, no matter how painful, if you have a knee pain, walk. That's one. I don't know how true that is. And that if you start walking, the pain will subside. That's one. Then two, the injection on the knee that you mentioned, I read somewhere that it could make help you gain weight. It could make you gain weight also.
Well, first of all, if you have pain, the best thing when you're having the pain is to rest it. You do not make pain better by using your joint. So you must first of all treat the pain, and then you can walk.
Okay.
What I normally would advise the patients that walking is quite good for you. It helps actually to ameliorate the pain in the knees. If you're going to walk, just take a couple of Panadol tablets before you do so. Okay. That would take care of the pain. Okay. Now, the issue of injection into the knees. There are two major types of injection we give. One of them is a steroid. Okay. If a steroid is well given, it sits inside the joint. It does not go inside the body. Okay. So it has no effect on it. Okay. But there's another one which, what it does is to lubricate the joint. Okay. Our joints, God in His infinite mercy, has provided a lubricating fluid for our joint, which we call the synovial fluid. As we develop arthritis, that lubricating fluid sort of dries up. Okay. So we can inject very close to that, and that helps to lubricate the joint and reduce the friction and reduce the pain.
Thank you. Prof, I'm honored.
Thank you very much.
And my apologies for keeping you waiting.
It's okay.
Thank you. I appreciate. And I will call on you from time to time to come and discuss some other specific problems with the joints. Thank you so very much.
Thank you very much for inviting me.
Thank you. And viewers, we've been talking about arthritis. Now you know the different forms of arthritis, you know, and if you're faced with any of the issues we have talked about here, you watch your diet, watch your lifestyle, like doctor has said, and watch whatever it is that is causing this pain, and try to stay away or fight your weight, and make sure you keep your weight at a recommended level where you'll age gracefully by fighting it all the way. My name is Yudi, and thank you for your time. And every week we will bring you information on issues, rights and privileges on the Yudi Factor. You have a wonderful week ahead of you, and goodbye.